This is Kathy, a girl in her teenage years. Kathy has always been a perfectionist and rather shy person. Her most prominent strength is creativity. Kathy loves drawing. Love of learning and kindness are also strengths of Kathy. Kathy was quite satisfied with her life, but after her ex-boyfriend started dating her best friend, she started feeling very sad and betrayed. She tried talking to her family about it, but no one seemed to really understand her, which made her feel very frustrated. To somehow cope with her negative emotions, Kathy started focusing her energy on her studies, which eventually led her to eat less. Other people rapidly showed admiration and attention for her weight loss, which made her more and more obsessed with tracking food intake and restricting her eating behaviors. Kathy thinks that she needs to lose more weight to look better and perceives herself as being overweight, even though her thinness gets more and more dangerous. By now, family and friends are very worried about her and wonder if Kathy has any disorder and how her symptoms can be treated to help her decrease her obsession with food and her negative body image. Based on this information, Kathy is diagnosed with anorexia nervosa binge eating purging type, according to the DSM-5. Getting specific treatment is thus very important for Kathy because eating disorders such as anorexia nervosa can be life-threatening when affected individuals are not helped.
Now it is clear that Kathy needs help to treat and hopefully overcome the symptoms she is experiencing. There are different ways to help her, but at best the intervention offered should match her main character strength. Thus, in this intervention, the goals that are set for Kathy are strongly based on her main assets, making them realistic for her, which is very important. Firstly, Kathy is supposed to spend at least 30 minutes drawing each Sunday. Here, Kathy can express her character strength, creativity, focus on something else other than her body and experience success and control over her work. Another goal for Kathy is to practice mindfulness for 10 minutes each day before going to bed. This can include things like yoga, meditation, or journaling, each with the aim of increasing her conscious awareness while making her less critical of herself. This goal is based on a strength of love of learning, as people high in that domain have a natural affinity to developing mindfulness skills. Namely, because mindfulness provides a way of increasing one's knowledge, which is exactly what people with a strength love of learning are motivated by. Lastly, fostering her strength of kindness, Kathy should perform at least one random act of kindness each day. This is especially important to rebuild and strengthen the relationships that have suffered during the development of her eating disorder. It would also increase her general happiness and life satisfaction.
Next, we will talk about the combination of approaches within the intervention. It involves a combination of the pathological and positive approach. The positive approach to treating Kathy makes sure that she lives up to her strengths, feels more resilient, and increases her well-being. The well-known pathological approach to treatment means that the focus lies on her illness symptoms, and this will help her recover from these. Therefore, combining the approaches creates treatment where Kathy's health is not defined on the absence of disease, but rather by complete physical, mental, and social well-being. For the pathological approach, enhanced cognitive behavioral therapy complemented with mindfulness was chosen. For Kathy, this means that together with clinicians, she will be working on forming healthy eating patterns, coping with her emotions, and regaining weight while learning to behave more consciously and act with more self-acceptance through the practice of mindfulness. For the positive approach, important, enjoyable, and meaningful activities has been chosen to fit the program for Kathy. This part of the intervention focuses on creating meaning in life through these activities. Moreover, a state of happiness can only be achieved through activities that have noble and meaningful purposes. Thus, it is important for Kathy to take part in activities like these to find meaning and happiness in her life.
So, what does the intervention look like? It consists of a 1-year-long treatment plan with different phases. At the very start, Kathy will start with mindfulness training guided by a psychologist, and she will continue practicing mindfulness throughout the whole course of the treatment and after treatment has ended. Through mindfulness, Kathy can increase her self-awareness and non-judgmental self-observation. This will help her prevent falling back into old eating patterns, and it will help her in the next step of the treatment, where self-monitoring is required. This next step is enhanced cognitive behavioral therapy, and it starts after Kathy has been practicing with mindfulness every day for a month. As we mentioned earlier, during this period, Kathy will be working with clinicians to reduce her illness symptoms. After at least 6 months, she will finish the CBTE treatment and move on to the positive psychology intervention, important, enjoyable, and meaningful activities, which will last 3 months. This intervention consists of performing 3 activities. The first one is a pleasurable activity carried out alone. For this activity, Kathy's strength of creativity is used by inviting her to draw by herself for at least half an hour every Sunday, which was one of the goals of this intervention. A second exercise is completing a pleasurable activity with others, mainly focusing on improving her relationship with her parents. Kathy is invited to engage in interactions with her family that are not centered around food or exercising, at least twice a week. The intervention's last aspect is the exercise of completing a meaningful or important act, which is related to the goal of performing one random act of kindness each day. Kathy will be given weekly meaningful or kind acts for each day via email, with the difficulty of the activities increasing as she gets further in the treatment.
We believe that these 2 approaches are a very beneficial combination of treating Kathy's symptoms and increasing her well-being, while positively acknowledging Kathy's strength. They can help her find other enjoyable activities that make her happy and that show her the bright side of life, but also how to deal with negative emotions more appropriately without falling into disordered patterns. Thus, 1 year after finishing her treatment, Kathy probably still meditates once a day and enjoys helping others and lightening up their days by doing small favors. She became more self-confident and is happy that she gained some weight again. Kathy has a good familial relationship now. Her family is much more open and available to discuss emotions and takes Kathy seriously when she addresses them. Together, they regularly engage in activities, such as going for walks, to which all of them look very forward. Her ex-boyfriend and her friend are still dating, however this does not bother Kathy. She's very happy for them and started meeting up with her best friend again some months ago.